Okay, so without further ado, I'd like to turn it over to Dr. Hutz. Thank you.
Can you hear me okay?
Yep.
Mashlomchem. Thank you so much for the beautiful introduction. So this is obviously a very important topic. COVID has really consumed all of our lives for the last year. So I'm really hopeful that with this vaccine rollout that we're nearing the end here. So again, I'm Dr. Hutz. I'm a geriatrician. So I'm not an infectious disease doctor. I'm not a microbiologist, but I have a geriatrics clinic. And so of course, all of my patients have questions about the vaccine, whether they should get it, and questions about it. So I'd like to answer some of those questions for you too today. So the first, let's see if I can. So the first question is, why should you get the COVID vaccine? So the most obvious reason is it prevents infection, it prevents death by reducing the chances of getting sick, but sometimes you don't think about the long-lasting effects that COVID can have. So I hope that you don't know anyone that's had this, but I've had several patients who have had COVID, and then for weeks after, sometimes even months, they had either a chronic cough or shortness of breath, fatigue, this joint pain, muscle pain, and this can last for such a long time. And so if you get the COVID vaccine, you can also avoid these long-lasting effects. So why you should get the vaccine: preventing infection and death and the long-lasting effects. Can the COVID-19 vaccine give me COVID? None of the currently developed COVID-19 vaccines have the live COVID virus. So some vaccines that we have are called live attenuated. So that means that we use the actual live virus and we just hurt it a little bit, so you can't get the actual virus, but you can produce antibodies against it. So that's like the MMR, the measles, mumps, rubella. That's an example of a live vaccine. And sometimes you can get it if they don't hurt the virus enough, but these COVID vaccines are not live attenuated. They are not made with the live virus. You cannot get COVID from the currently made COVID vaccines. The vaccines cannot give you or anyone else COVID, and they cannot make you contagious with COVID. Will I test positive for COVID-19 after getting vaccinated? The short answer is no. The vaccine will not cause you to test positive on the viral tests, like the PCR test, the rapid test, the antigen test. None of these will be positive after you've gotten the vaccine. However, if you get your antibodies tested, which is called serology, you should be able to test positive, because that's the purpose of this vaccine, is that we want to produce a good antibody response. And so you will likely test positive for the antibody test after you've had the vaccine. So what COVID-19 vaccines are available now? Right now, there are two available. It's the Pfizer-BioNTech and the Moderna. And both of these are mRNA vaccines, and I'm going to go into what exactly that is. The Pfizer vaccine was granted emergency use authorization, if you've heard that phrase in the media, the EUA. They were granted that on December 11th, and the Moderna very shortly thereafter on the 18th of December. What's really remarkable is both of these studies that were done for these vaccines, they were very large scale trials, 44,000 participants in the Pfizer trial and 30,000 participants in Moderna. So that's a really, really good sized trial. The Pfizer showed 95% efficacy and the Moderna 94% efficacy. You've probably also heard one of the challenges is storage, because the Pfizer vaccine has to be stored very, very cold, -70 degrees Celsius. And the Moderna is just standard cold storage at -20. Pfizer-BioNTech, they are planning on having 1.3 billion doses for the entire world in 2021. So that's an incredible amount. And the Moderna, 500 million to 1 billion this year in 2021. So what is the difference between EUA, the emergency use authorization status, and the full FDA approval? So when an effective vaccine has been demonstrated in a trial, it can apply for the EUA status with 2 months of post-vaccine safety data. So that means that the trial has been completed, and after the end of the trial, 2 months after that, they can apply for this emergency use authorization. To get full approval, the full FDA approval, it has to be 6 months of post-vaccine safety data. And so both the Moderna and Pfizer got this EUA status in December, meaning that they were 2 months of post-vaccine safety data. So 2 months from 4 months from December, that will be 6 months, and they'll be able to apply for full FDA approval. So now this is a big question that I get is, what is this mRNA vaccine? Because it's something that's new. We don't know a lot about it unless you're in the medical field. So both the Pfizer and Moderna vaccines are made with mRNA. And if you remember back to high school biology, mRNA is messenger ribonucleic acid. And so what that does is the mRNA instructs your body to make a specific protein, if you've heard the phrase spike protein, found on the surface of the COVID virus. And so our body makes this virus, but then our body says, wait, that's not part of you, that's not human. And so your body develops antibodies to it. And so the mRNA, again, it makes this specific protein that's found on the virus. And then our body will recognize it that that's not part of you. And so it makes antibodies against it. And these antibodies will protect you if you encounter this virus later. So another question that I've been asked, because this has been going around the media like Facebook, is that does the mRNA, does that affect your DNA? Does it affect your RNA? Does it change your DNA to RNA or your RNA to DNA? And the answer is no, absolutely not. After making this protein, your body destroys the mRNA. It does not mix in your genetic code. So the mRNA is there to make this protein, and then it's a protein itself. And so your body breaks it down, your body destroys it, your body gets rid of it. It is a novel vaccine, both of these Pfizer and Moderna mRNA vaccines, but we have used mRNA vaccines in the past for flu, for rabies, for cytomegalovirus, and then the Zika virus that was going around a few years ago. So we have had mRNA viruses in the past. Should I worry that the vaccine was made so quickly or step skipped? There were no steps skipped. All the COVID vaccines being submitted for approval must meet high US safety standards. All the vaccines to be distributed in the US were helped by funds from the government. If you heard of Operation Warp Speed, some large private companies provided funding and some got money from the government and from these large companies. And so how exactly would more money allow this to be rolled out faster? There are 3 ways that happens. Number 1 is trial enrollment. So like I was telling you before, huge number of people in these trials, tens of thousands of people. And obviously to get so many people enrolled in a trial, you need staff members to be calling these people, to be recruiting these people. And so if you have more money, then you have more money to have staff members who can recruit these patients. Number 2 is manufacturing. If you have more money, you can have more manufacturing plants, you can have more warehouses, you can have more employees. So money really helps with the manufacturing. And then of course, distribution. That if you have more money, you can distribute these very, very quickly around the whole world. How well do the vaccines work? So again, these were really, really big trials. And these were very good trials, because if you hear about, oh, this trial was very small or this wasn't a blinded trial. So what that means was that in both the Pfizer and Moderna studies, the participants were randomly assigned to 2 different study arms. So one of the groups received the vaccine and one got injected with something, but it wasn't the vaccine, it was a placebo. And you didn't know which was which. So you went in and you signed up and said, yes, I want to be part of this trial. And you may have gotten the COVID vaccine and you may have gotten nothing. And you don't know which is which. And then the participants were allowed to live their lives, mix with their communities, do everything that they normally would. And then they saw who got COVID and who didn't. So the trials reported a remarkable 95% and 94% efficacy in preventing COVID-19. An efficacy of 95% means that the vaccine group had only 5% of cases seen in the non-vaccine group. So for example, if the placebo group, so that's the fake group that did not receive the vaccine, if the placebo group had 100 cases of COVID, the vaccine group who had the actual vaccine, there were only 5 cases of COVID. So that's excellent. That is so much higher than a lot of other vaccines that we have. It's really remarkable. And the vaccine not only prevented COVID-19 overall, it also prevented serious cases of COVID-19, which is also so important. So these are just the numbers if you're interested, that with the Pfizer vaccine, the total number of cases with all of the tens of thousands that were in this study, 162 developed COVID in the placebo group, the fake vaccine group, and 8 in the vaccine group. And severe COVID, it was 9 in the placebo group and 1 in the vaccine group that developed very severe COVID. And similarly with Moderna, of all the tens of thousands of people in the study, 185 in the fake vaccine group developed COVID and only 19 in the vaccine group. And what's really remarkable is that no one in the vaccine group developed severe COVID with the Moderna vaccine. It's really incredible. So both vaccines protected well against across all ages of adults studied. The Pfizer had a 96% efficacy for ages 16 to 55, and over age 55, it was a little bit lower at 94%. And with Moderna, there was a 96% efficacy for ages 18 to 65, and over age 65 was 86%. And you might be thinking, why is that so low? The over 65 was 86% versus the Pfizer over 55 was 94%. The difference between those could be due to the cutoff for the trial. For example, it is possible that the Pfizer vaccine would have a lower protection effect if they had reported data for over 65, but Pfizer had done over age 55. How many doses do I need? So again, the only 2 that are available right now are the Pfizer and the Moderna vaccines, and these are both a 2-dose series. So if you want to achieve that 95% and 94% protection levels, you need to have both doses. The Pfizer dose is given 21 days apart, and the Moderna is given 28 days apart. Another really big question that I get is, am I protected as soon as I receive the vaccine? Can I stop wearing these masks? Short answer is no. The protection provided by the vaccine starts 7 days after the second Pfizer dose. So if you're going to get the Pfizer vaccine, 1 week after your second dose, you are protected. If you're getting the Moderna, you have to wait 2 weeks after the second Moderna dose. The caveat to this is if your rabbi says that you have to wear a mask to Shabbat services, you still have to wear a mask to Shabbat services. Even after you're vaccinated, all policies, protocols, public health orders related to COVID remain in place unless you are notified otherwise. What side effects do vaccines have? So I'm sure that you probably know someone who's received the vaccines, and of course there are side effects to almost everything. So far, as we've mentioned, the trials indicate that the mRNA vaccines are highly protective to generate a strong immune response. But sometimes that strong immune response can cause you to have side effects that feel like the flu. If you get these side effects, it does not mean that you're infected with COVID. It does not mean that you're contagious with COVID. It just signals that your body is successfully generating an immune response to protect you from the virus. So the most common things that we have seen are fatigue, that you're just feeling really tired, that you might have mild headache, muscle aches, chills, joint pain, low-grade fevers. What we've seen is that these side effects often happen between like 18 and 20 hours after your second dose, and they can last about 24 hours. And that's usually what we see. If I have food or medication allergy, should I worry about an allergic reaction to the vaccine? So the risk of an allergic reaction does exist if you have a known allergy to the vaccine. So if you received the first vaccine and you had an allergic reaction to it, you're going to have an allergic reaction to the second one. Also, if you have an allergy to an ingredient in the vaccine, then obviously you will likely have an allergic reaction to it. The mRNA vaccines are not made in chicken eggs, so there's no additional risk for people with known allergies to eggs. If you do have a lot of serious allergies, you should consult your doctor before getting vaccinated. What's good to know is all vaccine distribution centers, so whether it's through the IDPH, the Illinois Department of Public Health, or if you're going to a Mariano's or a Walgreens, they do have emergency allergy medications on site. The CDC recommends that everyone vaccinated be observed for 15 minutes after the vaccine, or if you have a history of anaphylaxis, so that's a really severe allergic reaction, you should wait 30 minutes. And so that's just something that's good to know, that if you have an appointment at 2 p.m., just know that you're not going to get in and get out right away. You're going to go in, you have to wait the 15 minutes, and then you're able to leave. What if I missed my second dose? So I'm going to talk about in a little bit about scheduling these vaccines. And sometimes it's difficult that, okay, I got my first dose and now I'm having a difficult time scheduling my second one. Really try to get your second dose on time. The data that we have on the vaccine benefit is based on a fixed number of weeks between doses. But if you're late, you should still receive the second dose. Another question I get is a lot of people in Illinois and Florida have already gotten COVID. So if I've already had COVID, do I need the vaccine? And the answer is yes, that even if you've had COVID-19, you should still get the vaccine. And the reason is that natural immunity to COVID-19 after infection is unpredictable. So we've known already from studies that some people who test positive, that they had no symptoms, they were totally asymptomatic, but they tested positive for COVID, they sometimes have a very, very weak immune response. And so they may not develop any antibodies, or they may develop some that go away very quickly. We've also seen that if you've been very, very ill with COVID, that you've had to be hospitalized for it, often they have a better immune response, but it's still very variable. So if you get the vaccine, it ensures that you will receive the same protection levels that were found in the trials, which are so good, the 95% and 94%. The vaccines should not be given to anyone who is actively infected. So if you are recently diagnosed with COVID vaccine, you should not get COVID virus, you should not get the vaccine. But after you make a full recovery, you can and you should receive the vaccine. So another question, who pays for the vaccine? At this time, these two mRNA vaccines, the Pfizer-BioNTech and the Moderna, are free because the US government has purchased millions of doses. In the future, though, this could change. So in the future, the government may purchase more doses. They may expect your insurance to cover it, or you may have to pay out of pocket. We just really don't know. So it's a good idea that if it's available, that you get it sooner rather than later. Another big question. So let's say that I have answered all of your questions and I've assuaged your fears and you want to get the vaccine. So how do I go about doing that? Well, what's very exciting is that here in Illinois, phase 1B starts tomorrow. And there's been a lot of chaos, I would say, some confusion around this vaccine rollout. And so you may know some people that have already gotten it and some people are waiting. But officially in Illinois, phase 1B, so that means that anyone in Illinois who's over 65 is able to get the vaccine starting tomorrow. So what steps should you do to get this vaccine? Number one, best idea, contact your primary care doctor because they probably have information to find a way for you to get this vaccine. So for example, as mentioned, I'm at Swedish Hospital, we're part of North Shore, and I think that one of the listeners here received an email. So if you're a patient of North Shore, you will, if you're signed up for the portal, the North Shore Connect, you'll receive an email. This is how it worked when I received my vaccine, that you'll receive an email saying that you're able to sign up for a vaccine. You click on the link, get into your North Shore Connect portal, and then you're able to look at multiple different days and times, and you're able to schedule right online. It's very, very easy. And that's hopefully starting tomorrow. We don't know how quickly that's going to happen. Number two is you could also look at the Illinois Department of Public Health. They have a lot of information on there about getting the vaccine. And then also CVS, Walgreens, Jules, Mariano's, they are all also going to have the vaccine that you're able to sign up for. I've had a lot of patients who have been trying very hard to get on, and they've been trying, and their children have been trying for them as well. And it's been really difficult. So I do have a hot tip. And I heard this from one of my colleagues, and I did try this a few days ago, that if you want to get the vaccine, and again, I would first try through your primary care doctor, but if the primary care doctor says it may be still a few weeks still, and you really want to get the vaccine, you could try Walgreens. And so what Walgreens does is at midnight is when they release all of the appointments for the next sequential day on their vaccine calendar. And so, for example, on January 22nd at midnight, I logged in to see what was available. And just an hour before when I had looked, no slots available. Everything was booked. You couldn't get in. Well, I looked right at midnight on the 22nd, and there were openings for January 27th. So that's 5 days later. And so if you get in right at midnight, you may already be in bed, but if your kids could sign up for you for a slot for you right at midnight on the Walgreens website, you're able to, that's when they release all of the new appointment dates. So in conclusion here, I did get my vaccine. I'll tell you how it was for me. Often people are getting these side effects after the second. The first one's usually pretty easy. And then after the second vaccine is when you get some of these side effects. I think that I was one of the lucky ones that I had some arm soreness, and that was it for me. I didn't have any of the body aches or chills or fevers. I think that is more common to have some kind of effects like that, because again, it tells you that your body is working and your body is producing these antibodies against the COVID virus. But for me, no side effects at all. That's all I have today, and I would love to answer some questions if you have any.
Thank you very much, Dr. Hutz. Yeah, we've got, I'll just start reading them off since we have quite a bit of time. I have I have a seafood allergy. Should I be concerned about side effects from the vaccine?
So there's nothing that I have read that would be a concern with allergies to seafood, no.
Okay. What happens if you've already had COVID?
So like I mentioned, even if you've had COVID, it would be a good idea still to get the vaccine. If you were recently diagnosed with COVID, wait until you are fully recovered, and then you're able to get the vaccine, but you still should.
Okay. I think that the votes on the EUA were not unanimous. Those who voted against it, what reasoning did they have? Do you know?
I am not too familiar with that. I don't know the answer. I'm sorry.
Okay, that's okay. Does the vaccine prevent infection and transmission, or simply minimize the COVID symptoms?
That's a really great question. So it prevents infection. So sometimes if you hear that the shingles vaccine that you get, you can still develop shingles, but it's usually milder. With this, it will prevent you from getting COVID. If you have a strong antibody response, you'll have antibodies that you will not get it. What's interesting though is about transmission. So what we've seen in some studies is that you're still able to transmit it. And the way that you do that is because if you come into contact with someone and the virus gets into your nose, for example, then it could, even though you're not infected, the virus could be in your nose. And then if you cough, if you sneeze, you could transmit it to someone else, even though you don't have the virus yourself. So it's less likely, but we have seen some studies that show that it is possible.
Given that the vaccines are 94 to 95% effective, can an antibody test, there's nothing more, but probably can it be picked up on an antibody test? Is that?
Yeah, that's really interesting. I'm looking forward to myself. So I had my second about 10 days ago, and I would like to get my antibody to check. But yes, you should test positive for the antibodies once you get the vaccine.
Mm-hmm. Well, I have a quick question, is that I had COVID and I was trying to get into a North Shore study. And so they tested my blood to see what level of antibody I had.
Oh, interesting.
From 1 to 250, and I was only at 14. So I definitely need a vaccine.
Yeah, that's so interesting. And again, it's because it's so variable that what your immune response is. Yep.
But I guess my question would be, if I have the vaccine, would my antibody level be like 1,000 because it's so, it's so saturated, or would it still be at like 250, like the maximum?
I'm not exactly sure. I just know that it will be much higher than 14.
Okay. Yeah, I'm hoping that was pretty low. Okay. Do we know what the 5% of those who developed COVID-19 after receiving the vaccine have in common?
That's a really good question, and no, we don't. And so we can sort of just speculate that, again, so for example, I have patients that come in and need titers. So that's exactly what you had done, that they measure titers, which is exactly how many antibodies that you have. And so if someone comes in and says, I need my titers against measles, mumps, and rubella for work, then we measure not only are you positive, but do you have enough that we know that you would be protected? And the answer may be that these people had some antibody development, but not enough to prevent COVID. And we don't know that yet. But that's one of the speculations that we think.
Okay. Oh, here we go. Okay. Rabbi Schechter, gave more of his question. Thank you, Rabbi. Given that the vaccines are 94 to 95% effective, can an antibody test after the second vaccine determine whether you are in the 94 to 95% group or in the 5 to 6% group? Like, if you're going to get COVID or not after the second vaccine?
So the answer is probably. I don't know that anyone would be able to do that. You were able to get your actual titers checked because you're part of the study, but at least through my hospital, we do not have the capability yet to test how high your antibody levels are. And so maybe in the future, but I know that through North Shore, at least, that's not something that we have a test for yet, to test for titers.
Okay, so if you could get to some place that could test your level of antibody, you might be able to figure out if you would be in the 5% group that would get.
Yeah.
Okay. Will we be told which vaccine we'll be receiving? You should.
Yes. So if you, for example, sign up through North Shore or go to Walgreens, you will be told which one that you get. Yeah.
Okay. Is it important that you be told?
No, just if you want more information about it. I wanted to know which one I received, but it didn't matter to me whether I got Moderna or Pfizer. It wouldn't have mattered.
Okay. How can we be assured that we will receive the second vaccine dose?
Yeah, that's a really good question, because I've had some patients who somehow were the lucky ones that have already received the first dose, and now they're kind of struggling to get the second one. So if you go through Walgreens, for example, it could be difficult to schedule your second dose, and that's what some of my patients have been finding. I hope that through North Shore that we would, so how it worked for mine was that when I signed up through North Shore for my first vaccine, it automatically set my appointment 21 days later, the exact date, the exact time. And so I didn't have to reschedule it. And so that's how we did it at North Shore, but I don't think that Walgreens is doing it that way. But that's a really good question, that if you get it through Walgreens, you should right away try to set up your second appointment 21 days out if you're getting Pfizer.
Do we know how long the protection lasts after you've gotten the vaccine? Do we have to revaccinate every 6 months, every year?
That is such a good question. And this is new, so we don't really know. And some people are saying that this may be something like the flu shot, that we need to get a repeat vaccine every year, but only time will tell. We need more studies.
Okay. What about taking Benadryl and/or Tylenol before the vaccine?
Yeah, so this is another question that I've gotten. So pre-medicating is okay to try to avoid the side effects, but there have been some studies that have showed that you can have a blunting effect, that you're decreasing the immune response, and so you may not have as strong of antibodies that are created. And so it's in these studies that we've seen, it only happened if you pre-medicated. So if you get the vaccine and then once you get some of the symptoms a few hours later, then you take some Tylenol or ibuprofen or whatever, then we don't see this blunting effect. So try to not pre-medicate, but after you get the vaccine, you can take some medication.
Thank you. Is there any possibility of choosing whether to get the Pfizer or Moderna vaccine, especially since Moderna is less effective for people over 65? Also, will your slides be available for us to review and share following this presentation?
Sure. I can send them to you, and they can be available.
Okay.
I think that it depends. So right now, North Shore has only Pfizer. And so I think it depends on where you're going to get your vaccine.
Okay, thank you. How do we determine whether we are in the 95% group effectiveness or the 5%?
Yeah, and again, it would only be if you were able to check titers. So 95% is so high. That's such a high number. These vaccines are absolutely incredible how this is. So it's unlikely that you'd be in the 5% group, but obviously 5% of the people did end up getting COVID. But right now you'd have to get titers run, and we do not have tests for that outside of if you're in a study.
Was there anything common to that 5%? Were they all X? Were they of a certain age? Were they?
No. I think that they're still looking at why they developed COVID.
Okay. How effective is the Johnson & Johnson vaccine?
Good question. So I can tell you a little bit about the Johnson vaccine. So we don't know the efficacy yet. We are thinking that it will be very high, like the Pfizer and Moderna, but they have not released their data yet. So we do not know. What we do know about it is that it is a single dose. So you would only need to get one dose. You don't need to reschedule to try to get a second dose. And it does not yet have EUA. So it doesn't have the emergency use authorization yet.
Okay. Will we need to get boosters down the road?
Yeah, and again, we don't know. It's possible that this may be a yearly thing, maybe not. Only time will tell with more data.
Okay. I'm sorry. What if you have an autoimmune disease and you are immunosuppressed?
That's a really good question. And I was actually talking to a rheumatologist recently because I had a patient who was on a monoclonal antibody medication for, I can't remember what she had, maybe psoriatic arthritis or something. And definitely talk to your primary care doctor about it because every case is different. But in general, the National Society of Rheumatologists has recommended that if you have an immune disease, you should get the vaccine because you're in a higher risk group of having severe COVID symptoms. And so you should still get it, but definitely talk to your primary care doc who knows your history. But from everything that I've read, you would be a good candidate and you should get the vaccine.
Okay. You should get the same product, meaning like Moderna, and you should get the same one the second time, correct?
Good question. Yes. If you've received the first Pfizer, you should get the second Pfizer. Yeah.
Okay. How do we find the ingredients in the vaccine? I'd like to know if it has any ingredients of
enalapril. Yeah, if you have an allergy to that. Good question. If you Google it, they do have the ingredients that you can look in each vaccine. There are a lot of them because it's a vaccine, but it is available if you can Google the ingredients. Okay. I don't know off the top of my head if it shares any ingredients with enalapril.
Thank you. And then what types of autoimmune diseases are of concern with COVID-19?
So any kind of autoimmune disease puts you at increased risk of having some more severe reaction to COVID and more severe disease. And so anytime that you have an autoimmune disease, whether it's like lupus or certain types of like type 1 diabetes or any of those, they can increase your risk of severe disease.
Okay, thank you. And what if you've had anaphylaxis to numerous meds?
That is such a good question. And that is something that I would talk very closely to your primary care doctor and go through exactly which medications you've had anaphylaxis to, and then see if they can look up if there are any shared ingredients, because that's very scary because COVID is scary and having anaphylaxis is also very dangerous. So definitely talk to your primary care doctor before you get the vaccine.
Thank you. Anyone else have any questions? I know we've gone through quite a few and we still have a little bit of time, but any other questions about anything? Thank you very much, Dr. Hutz.
Yeah, sure. Very happy to be with all of you today. And if you have any questions that you can think of, you can email them and send them over to me.
Yes, if you email to me, I will give everyone my email address, and you can send me any questions and I will send them to Dr. Hutz. All right, so Bill, do you mind unmuting everyone? They can thank you and then we'll say goodbye. And she's accepting new patients. And if you're interested, this is another shameless plug, is that her phone number, just in case you like it, is 773 292 4200, and it can be found at 5060 North Broadway, which is just south of Foster Avenue. So thank you again, Dr. Hutz, for giving of your Sunday to us. We really, really appreciate it. And this is terrific. Thank you very much.
Thank you. Thank you.
Thank you so much.